Hi, this is Dr. Kahl Goldfarb with Water and Sports Physical Therapy. Today we're going to talk about hamstring pain, the underlying sources of pain and where they come from. So let's start with the most basic and straightforward of hamstring pain, which would be a hamstring strain or a muscle tear. So what happens with a muscle tear is typically you'll have an acute trauma, you'll be running, something will happen, and then you'll feel a sharp pulling pain in your hamstring. Usually this is done with an eccentric contraction. So it's when you're slowing yourself down, or your legs reaching really far for first base, and you come down on it, and then as you slow your body down, the muscle pulls. That's the strongest type of contraction, and it's the easiest way to have a tear. Usually accompanied with a hamstring tear would be acute pain, swelling. Usually the next day you'll find some bruising. And what you want to do with something like this, straightforward, is to have it checked out, make sure it's not more serious. If it's not more serious, then you want to ice, elevate. You can compress with ACE-RAP if you do it correctly, and you want to let it rest. And as soon as you can, pain-free hamstring exercises, non-weight bearing, and you progress from there. Now, some of the more complex areas that can cause hamstring pain, first is the SI joint. The SI joint is the area right behind your glutes. There's two spots usually you'll point to, and you'll say it hurts here or here. If somebody tests it, you probably will have pain over your SI joint. That SI joint can refer pain right to your hamstring. Often you'll feel some pain in your SI joint in addition to your hamstring. A physical therapist or a physician could usually help diagnose or differentiate if it's coming from your SI joint. The other thing that causes pain is your low back. There's two or three common areas, usually the lower lumbar spine, that can cause low back and sometimes just hamstring pain. Sometimes you won't even feel it in low back. So, here are the three options. The most common areas are your facet joint. The facet joints are the joints in your spine that are in the back. So if you were to backward bend and rotate to compress those joints, you might refer pain from your back down toward your hamstring. When you bend forward and away, that wouldn't cause pain from a facet joint, but could cause pain from a disc. So if you have a disc bulge or herniation, the disc itself can be hitting a nerve root or not. So if your disc is enlarged and the nerve root's on the side and it compresses the nerve root, that can cause pain right down the leg. Or if the disc has a lot of pressure on it and just is enlarged itself, that pressure just around the annulus, the fibers surround the disc, can cause pain down the leg. So you definitely, if you think it's coming from your back, you need to get it checked out, because the things associated with nerve or disc pain can be muscle weakness in the foot and ankle. You can have sensation loss, so you need to make sure you don't have any lack of sensation. You can have tingling in your legs and reflex loss. So if those things accompany your hamstring pain, it's very important to very quickly see a medical practitioner to be diagnosed with the correct issue. So the key is here understanding that hamstring pain can come from many sources, one of which the hamstring, and many of which can be other areas. So make sure you're safe out there, and if you're ever wondering, feel free to check us out at waterandsportspt.com. Thanks.